I am here with Banu, and Banu, you were in about a year ago for a half-mouth scaling and root planing, meaning you've already been diagnosed with some sort of periodontal disease, periodontitis. So you might be familiar with some of it, but maybe you weren't properly educated on it when you were last in. So let's first go over what is periodontal disease, periodontitis, and then we'll talk about what I found in your clinical, medical history, dental exam, and then we can talk about treatment and where to go from there. So, first, periodontal disease, do you know what it is?
No.
Okay, so periodontal disease is also commonly referred to as gum disease, and it is caused by a buildup of bacteria called plaque or calculus, or it's caused by a buildup of plaque that eventually hardens and mineralizes into calculus. Have you heard of those terms before?
Yeah, maybe once or twice.
Calculus might also be referred to as tartar, and it just builds up in your mouth and then irritates your gums and eventually infects them and causes a disease.
Wow.
So in order to measure your severity of disease or to see how healthy your gum tissues are, we use something called a periodontal probe, which is basically just like a ruler, and it has different millimeter markings, and we just check to see what that measures, and we record them and keep track of them. So in healthy teeth and gums, you see here that the probe measures about 1 to 3 millimeters. That's what we want to see for every single tooth. And then we can see that it's surrounded by fibers and tissues, and it is supported by your bone. There's no bone loss, there's no inflammation or redness anywhere. It is completely healthy and no disease is present. If disease is present, your probe, first it is gingivitis. That's the early stage of periodontal disease, and it might be a little bit red and inflamed, your tissues, and the probe might measure about 4 millimeters or so, but there's no evidence of bone loss, making this the only form of periodontal disease that is reversible. So if you keep up good frequent professional care and maybe change your at-home care, then your gingivitis will be able to go away. If the disease is left untreated, it will progress into early periodontitis, where you see bone loss, and because the bacteria is starting to break down the supporting structures, you see more red and inflamed tissues, and then you get a probing depth of about 5 millimeters. And the only way that this can be untreated is through coming in for scaling and root planing or some sort of non-surgical surgical therapy, and then perio maintenance, so frequent professional care of about 3 months. Your tissues start to pull away from your teeth, and yeah, if this is left untreated, then it will go into moderate periodontitis and possibly even advanced periodontitis. So you can see in moderate that the probing depth just gets deeper with maybe about 6 millimeters. More bone loss is evident. You are able to see that on radiographs, and more tissues are pulled away from the tooth. You might start to get tooth mobility. As that bone decreases, you might get root furcations, meaning the root is exposed. And if it progresses into advanced periodontitis, which is what I might be seeing in you, you have a probing depth of 7 millimeters or greater, severe bone loss right there. So you can see that would be a healthy one, and you've just lost about half your bone in advanced periodontitis. There's no way to regrow that, so you want to treat that as soon as possible, and just try to manage that, or else it'll just keep going, and eventually we'll have to extract your teeth. And yeah, so some signs and symptoms of why I think you might have advanced periodontitis would be that you have very deep probing depths, especially in your maxillary left, so your upper teeth in your left region. You had very deep probing depths and bleeding. You had root furcations, where the probe was actually able to go to the other side of your mouth, right through them. You have active signs of decay. Your gums are not stippled, they're inflamed, and they're red and purplish, especially in your mandibular anterior region. You had heavy subgingival calculus in all areas of your mouth, you had tooth mobility in the maxillary left side, meaning you've lost so much bone that it's not able to support your teeth anymore and your teeth are actually able to move. And then you had evidence of bone loss on your radiographs. You had exudate or pus upon probing your maxillary left molars. So that is another sign of infection. And then you were complaining about bad breath and throbbing pain, especially coming from your maxillary left side. So from my understanding, you've already had to have your right back 2 molars, so your second and third molars extracted. And if your disease continues, you might have to have your second and third molars on your maxillary left side extracted as well. Some of your risk factors for this disease is you're 35 years old and that periodontitis is common. You have hypothyroidism and you are stressed about your doctoral research. So I would recommend for treatment to come in for frequent professional care of about 3 months. We will recommend doing scaling or root planing of your entire mouth, which is the non-surgical form of treatment, to see if that helps. You might eventually have to have surgery, like a surgical option. And then I would recommend a referral to a dentist or oral surgeon for your second and third molar extraction because the disease is so bad back there. And then good at-home care, and we can put together a treatment plan. Do you have any questions?
No.
Awesome.
Like I need to do better.
A little bit, but that's okay. We all do. Thanks for letting me present to you for this.
Mm-hmm.